Hey everyone, Dr. Crocker here. I am excited about this Instagram Live. I've been doing a series where I talk to different veterinary specialists and we talk about their journeys, and I'm really excited to have Animal Neurodoc on. He was Instagram Live visitors, so we will see if we can get him on here. Hopefully it goes a little... Hey!
Hey there. I made it.
I like... You made it. I made it. I
Okay.
literally just walked in the door 2 minutes ago. So,
Are you working on a Sunday night?
no, I actually recently took off Sundays. I said no more Sundays for a while, and I was just at a barbecue.
Okay,
So,
good.
no work, just having fun, on the
Good.
weekend. So,
Good. Good.
what about you? You're off. You work some Sundays though, right?
Yeah, so I'm on call every other weekend, and we have a resident which helps us out, which is nice. But yeah, so take call every other weekend. That's part of the deal. If you want to be a neurologist, you know you're going to be working on the weekends. That's kind of comes with the gig. So
Well, that's good to know. We're gonna kind of get into all that nitty gritty. So first, introduce yourself. I need to know how to say your last name because I was unsure.
yeah, it's I have clients that say Wininger and mess it up all the time. It's a tough name, so it's a soft G. So it's Fred Wininger is my name, and
Okay.
yeah, I can give you the whole bio, the whole route around the country if you
Yes,
want.
please,
So
please.
yeah, so I'm originally a Jersey boy. I can fist bump with the rest of them, and I did my undergrad in DC, and then I went to vet school and University of Philadelphia, and I did my
Okay.
internship at the University of Georgia, and then I did my residency out in Washington State University out in Pullman, Washington. So went from like big cities to small college town to tiny college town where there's cows running around the Walmart parking lot. And then I wanted to go into private practice, but the recession hit, and it wound up being the best thing that could have happened to me. So I wound up going into academia. I went to University of Missouri, and go Cougs. Yeah, go Cougs. Um, so the best part about working at Missouri is that University of Missouri is one of the hubs of translational research. So for those of you that don't know, translational research is
I
this
don't
kind of,
know. No
yeah, it's
clue what
this
that is.
it's kind of this buzzword that's really exciting. It essentially suggests that our animals, our patients, are models for human diseases. So what they focused on was finding genetic and phenotypic analogs for human diseases. And the value in that, of course, is that if you find dogs, as opposed to mice that you breed in a lab, if you find dogs that have the same genetic and phenotypic abnormalities as a human disease, then they're much easier to study because they share the same environmental stimuli and they share the same kind of experiences and all these other things. So we worked on a model of a disease called Batten's disease. The fancy word for it is neuronal ceroid lipofuscinosis, but it's basically a condition where children become cognitively dysfunctional in middle age. They become blind, they have seizures, and they die at 21. And the horrible part about this condition is that it tends to affect multiple children in the same family. Um, so we found dachshunds that had the same condition, and through working with some pharmaceutical companies, we were able to come up with a gene therapy that actually cured the disease in humans. So that was very rewarding because I think a lot of us in the veterinary field have felt like, what if I had been a human doctor? What would that have been
Right.
like? And so the ability to work on both was really cool. Um,
Okay, so I have to stop you here. I was concerned that the fact that you're a neurosurgeon, I have a lot of imposter syndrome, I guess, like asking you questions. So half of what you just talked about, I'm like, oh my gosh, like I spayed a couple dogs the other day and you're like curing human genetic neuro conditions. So one, that's very cool. Two, I feel very kind of inadequate, I guess, asking you questions about your journey because your journey has been so different from what, and most of us like general practicing veterinarians experience. But I have to tell you, you were one of the like most requested people for me to have on for these Instagram lives because you do such a good job of sharing your cases and kind of what you do, you know, in your practice. And a lot of people are very interested in your career path. So I, one, appreciate you coming on, but two, if I ask a lot of really stupid questions, you just have to give me a lot of a
No,
lot of
not,
leeway here.
and I think we all share imposter syndrome. I mean, like I mean, everything you said to me makes me feel really good. Thank you for saying all those things.
Yeah.
I no, for one, I'm just a cog in a wheel. Like I work as part of a team in that group, and I just have a limited skill set that enabled me to be a part of that. But I think more than that, you know, I think about my colleagues and I think about the veterinarians I get to work with, and yes, I think a lot of specialists choose to decide to be the master of one instead of the jack of all trades, right? But ultimately, I work with emergency doctors that I'm constantly going, that are generalists, and I'm constantly going to for help on what do I do with this torn nail bed, or how do I manage this cough? Like it really, the respect is reciprocal because I really, I think that I remember students coming up to me and I'd say, well, what do you want to do with your life? And they say, well, I just want to be a generalist. And
Yeah.
I'd say, no, you're not allowed to say that. The generalist has the hardest job in the world, right? For me, you've already evaluated the dog. You sent them to me because you knew that there was already paraparesis or ataxia. And you said, this dog has a neurologic problem. I want you to figure it out. For you, you have dogs coming in the clinic every day, and they're not presenting for a problem. They're just presenting because they're coming in, and you have to be the sentinels of animal health. I mean, I have the most respect in the world for generalists, and I think it's a much more difficult job actually than being a specialist for what it's worth. So,
Well, I very much appreciate that. I'm very excited to talk to you because I went to A&M and M and we have a lot of really great neurologists there and a lot of really great research. And I always thought it was a very interesting field. And you are a neurosurgeon. So let's back it all the way up to like, because I always make everybody start like pre-vet school. So talk to me a little bit about pre-veterinary. When did you decide you wanted to go down this path? And did you enter vet school thinking, I want to be in neurology, or did you just want to work on animals? What was that like?
yeah, that's great. So I started out like most of us working in veterinary hospitals my whole life, cleaning cages, cleaning up poop, and all that other great stuff that we all
Mm-hmm.
enjoy doing, all through college. And then I remember working for a veterinarian.
Oh, can't hear you.
Can you see me now? Yeah. So they were
Yeah,
cleaning
no, I can see
ears.
you. I lost
They,
you.
Sorry about that. So I remember thinking to myself, I don't know if this is for me, and I ventured into ideas of wanting to be an architect, strangely. I don't know why. But then I went back towards the veterinary field because it kind of, I think, like a lot of us, draws us back. And, ooh, dropped you. So I think the thing that made me want to be a neurologist is I had worked for neurologists. And what attracted to me most to the field is the idea that you get to wave your hands at a dog's face and you get to flip their feet over. And by asking them silly little questions, you get to reveal what's wrong with them. Not what's wrong with them, but where their problem is. And so I've always thought about neurology as the electricians of the house. You know, we get to know, we don't know why the lights aren't turning on, but we know that there's something wrong with the circuit, and we get to figure out where in that circuit there's a problem. So,
I do think it's very much a puzzle. I remember neurology class in school and walking in on the final, and there was a brain, and there was literally like 30 pins stuck in the brain. And it was like I had to say what that part was and spell it correctly. They were very big on spelling. And then, like, what I would see if that part was injured. And it was probably one of the toughest classes I had. But if you have the ability to learn those things and understand them, and like you said, like understand basically the electrical circuit of everything, then you really can be great at neurology. So I think it's really awesome how it's kind of the triggers and then what the body does in reaction to that and how it all kind of works together. So when you applied to that school, did you apply to multiple schools, one school? Did you get in right away? What did that look like for you?
I was a New Jersey resident, and so we didn't have our own vet school, so we had little contract
Mm-hmm.
seats, and I got into a number of the contract schools. I wasn't a very good student in undergrad. I didn't hit my stride until vet school. So between undergrad and vet school, I worked at I, I like a lot of us. I finished undergrad and I wasn't really sure what I wanted to do with my life. I thought about being a veterinarian, but I wasn't positive. And I opened up the Yellow Pages because my only job at the time was working for my parents, like power washing their deck.
Hmm.
And I applied to this veterinary hospital, and it wound up being a hospital called Red Bank Veterinary Hospital, which at the time wound up being the biggest specialty clinic in the country. And I had no idea.
Wow.
And so I was working there, just kind of doing non-licensed veterinary technician type roles. And I ran one day into the neurologist there. His name was Rick Glass, and he was kind of a tough guy at the time, you know. And I said to him, I like I was like kind of aggressive with him too. We were like bantering, and he's like, I like you. Do you want to be my tech? And so I didn't know what being his tech meant. What being his tech meant was waking up at 4:30 in the morning and driving to the imaging center to MRI the dogs, because at the time we didn't have an MRI in the hospital. And we would put catheters in the dogs, put them in crates, drive 5 or 6 dogs to the local imaging center, do MRIs before the human clinics patients got there, and then drive back.
Ah.
So if it hadn't been for that experience, and had it not been for the references that I got from that hospital, I wouldn't have been a competitive student. But I wound up being one, and Oklahoma State was one that I was really interested in. But then Penn offered me a position, and it was too close to home to turn down. So that's how I wound up at Penn.
Yeah.
Yeah.
Okay, but you're not in either of those places now, right?
Right. So after Penn, you know, you have to do an internship, which is why I went up in Georgia, which is a fantastic vet school. And I wanted an internship that gave me the opportunity to see all the specialties, because, like a lot of people in my field, I was interested in other things. And I've always found that people in different specialties kind of gravitate to other ones. So most
Mhm.
neurologists gravitate to either ophthalmology or emergency critical care, and never cardiology. Like cardiologists and neurologists, it's like a plumber and electrician trying to see the same type of
Hmm.
scenario. They don't get it. Um,
Yeah.
and we joke about that all the time. Like when I put a stethoscope around my neck, people look at me like, "Do you even know how
Yeah.
to use that thing?"
Like,
Um,
no.
yeah. But then after internship, I went out to residency in Washington State. I worked under my mentor, Rod Bagley, there. And the reason why I chose that residency is I wanted the most neurosurgically aggressive residency I could find, because I wanted the opportunity to see everything so I can make decisions for myself about what I wanted to do.
So did
And then
you entered vet school saying like I think I want to go the neurology track, correct?
I did. But I think what a lot of the people watching in veterinary school will find is that you gravitate to specialties that you're interested in, but you tend to gravitate more to specialties that are fostered by mentors that you emulate. So there was
Hmm.
even a period of time where I wanted to be a dentist. And it was because I worked with a dentist named John Lewis, and he was just so inspiring, you know.
Yeah.
So I went on all different paths, but I think eventually I was drawn back to neuro.
Yeah.
Yeah.
So when you left undergrad and you went into internship, was it a small animal rotating internship or was it more of a neurology focused internship? Because there's definitely different ones. And was it private practice or academia?
Great question. And just like a side note, a lot of like considerations for private practice versus academia. Ashley Gray and I did like a little video, and it's on my Instagram if anybody is having trouble making that decision. But I wanted it at the time, and I think it's less so true now. But at the time, I wanted my options to be as great and diverse as possible, and so
Mhm.
I chose an academic internship. So that's how I wound up at Georgia. Um,
Did you do research in undergrad? Because a lot of the academic internships are pretty competitive to get into, and a lot of the specialists I've talked to have said their relationships, like their networking, and then doing research and things like that seem to help them get those internships. What do you think got you into your internship, or what did you do specifically for it?
Great question. So I think that the number one and two things, having been on internship selection committees, the number one, two, and things that will get you an internship are your grades and your
Right.
references. And I
Okay.
think that so often all of us have we have so many interests outside of just studying, of course. and we want to do SCAVMA presidency, and we want to work for the Raptor Club, and we want to on the side like be a barista at Starbucks to make a little bit of
Yeah.
money, and
Yeah.
do some research on the side too. But
Mhm.
those things I think are extracurricular and actually a detraction from the establishing the credentials that would get put you in the best position for an internship. And I know we've all worked hard to get into veterinary school, so the thought of having to get kick-ass grades to get an internship is a little bit frustrating to hear. But the reason why grades are so essential for getting a good internship is because it shows an ability to start and finish something. It's not about your intelligence, it's about a path. And so grades are number one and references are number two. And I did do some research in vet school, but I don't think it was a major contributing factor.
I think that's interesting. Like some of the specialties, like zoo, they definitely want you to have research background, and that was like a huge part of it. And even getting like an MBA and or other type of masters helps. So it's very interesting. But number one, networking has been huge. I mean, I think everyone realizes grades are really important. I, thank goodness, did not need to worry about grades in vet school. I had a lot of fun and I did really well and learned a lot, but I didn't need to make great grades because I knew I wasn't pursuing a specialty. But I do think that's important to realize that you have to learn how to function in kind of a stressful situation and like you said, like push through, hit your stride, be able to make good grades. And that kind of speaks to who you are as a person and your ability to deal with that school in general, which then I hope would help you in your internship. So was your internship intense? Was it a long hours? Did you get paid anything? Like what did your internship look like overall?
Yeah, so internship, you get paid horribly. And,
Yes.
most, if you've got an internship, it means you worked really hard.
Mhm.
You've gotten good grades. You've put yourself in a position that you could get other jobs that are pretty high paying, wonderful
Mhm.
jobs. And instead you choose to go down this alternate path of match selection and stuff like that. So I think with my internship, my salary was like a $21,000 a year salary.
Yeah.
Um,
Yeah. It's
but
painful. It's
it's
painful to say that.
it is, but I knew it was a means to an end,
Right.
and I can say without reservation that since veterinary school, the best year of my life was my internship. I had so much fun.
I
I
love that.
was I was practicing stuff that I still wasn't super comfortable with, but I had learned about. I was working with mentors and doctors that I respected immensely. I was learning how to navigate the waters, the political waters of a hospital. I had an
Mhm.
internship class where we were all best friends. I'm still great friends with all my intern mates. And I was in a great place. Like Athens, Georgia is just amazing. So I have so many like case stories that I think about when I think about internship, about this great case or that great case that made me the doctor I want to be. I share them all the time. One of them made me want to be a neurologist. I remember to this day, I had this case. It was my second week of my internship, and this Pomeranian came in and it was paralyzed. It could not move any of its legs. And I bring the dog back into the ICU, and I'm like, I know what this is. Shave this
Yeah.
dog. And the emergency technicians are like, you don't want to do that. And I was like, I want you to do this. I want you to shave this dog because there's going to be a tick on it. And when you find that tick and we take it off, it's going to
It's
walk
gonna.
again. Yeah. So they shaved the dog, and we found the tick and we took it off. And a day later, the dog was walking again. And I'll never forget this. So I walk ceremoniously around. I'm the Yankee in the South walking around with a shaved Pomeranian. And I go,
Yeah.
and yeah, I'm
I
like,
found
look
the
at me,
tick.
look at me, look at me.
Yeah.
I found
Yeah.
this. And this dog's walking, and I like carry it to the owner. And she's like, what have you done? And I was like, I fixed your dog. And she's like, don't you know that Pomeranians get telogen effluvium? My dog's never going to grow its hair back.
Yeah.
And I was like, what's telogen effluvium? I don't know. So I had to look that up. And I was like, oh, crap. And to the for the next 10 years, she traced me around my path in my career and sent me a postcard of the dog on the dog's birthday every year to show me what I had done to that dog. So
Wait, wait,
that was
wait.
a,
Did it say like, thank you for saving my dog's life? However, it's still like a naked dog, basically? Is
yeah,
that what it
yeah,
said?
yeah. And it became like horrifically hideous because, as you probably know better than me, it became hyperpigmented because it was like alopecia all
Oh my
over.
gosh.
So the show dog was ruined, but it was walking. But anyway, those were the experiences of my internship that my intern mates put their arm around me and they're like, let's go get a beer because you did a wonderful, terrible thing today, you know? And
Yeah.
it was such a great experience. Yeah.
So I love hearing that because I also loved my internship. It was 68-hour weeks. Like I worked my butt off, but I went into it, I guess, eyes wide open. Like this is what it's going to be. And I had those cases that, yes, were so incredible and I learned so much. And so when I talk to people about internship, yes or no, I definitely think where you go and who you work with is huge. And then going into it, like understanding what it's going to be is huge. I mean, I expected it to be really hard and taxing and difficult, but I was going to learn a ton, and that's basically what happened. So, do you agree that internships are worth it? Obviously, if you're going to do a specialty, you have to do it, but do you agree that it does depend a lot on who you work with and where you go for your internship?
100%. I mean, I think that I came out of that school. I graduated well. I did well academically, and I had no idea what I was doing. And to be in an environment that fostered that idea that, yeah, you don't know what you're doing, but we're going to get you there, like
Yeah,
that was a really great environment. So I don't know what the alternative path is, you know, the going into general practice. And I work with referring veterinarians that I think are phenomenal doctors, and they didn't do internships. So I know it's
right.
not by any means mandatory, but for me, it was an experience that I would never pass up because, yeah, because they said, you are in your fifth year of training right now, and
Right.
and we're gonna make you better because of it. You know, it was
Yeah.
exciting. It was
Yeah.
exciting.
I love that. I love that. And I love hearing that you had a positive experience because I think a lot of internships get a lot of bad raps these days. And I think if you pick the right one, it can be the right choice for certain people. So you made it through your internship, you learned a lot, you loved it, and then you're looking at residencies. Were you looking at academic versus private practice? What did you kind of look at there?
Yeah, I knew I wanted to do an academic residency again at that time, and we're talking about 2006, 2007. Oh, man, I feel old.
I'm the
Um,
same way. I'm the same way,
oh
Josie.
God, I think I just yeah. Hold on a sec. Okay, I'm good. I at that time, academic residencies were the premier residencies,
Okay.
and there were really good private practice residencies, but they didn't hold the same um, status, if you
Right.
will. They didn't give
Mhm.
you the same opportunities coming out of residencies for jobs, and so that was natural for me. I think the bigger question for me was, did I want to be closer to home or did I not? Did I want to did I want it more neurosurgical or more medical? But at the end of the day, there's not that many residencies, so you take what you can get. Uh, I remember the day I matched, and the day you match, whether you match or not, you're supposed to like put a smile on your face because you're
Yeah.
supposed to be happy about it. And my friends are getting into like Baton Rouge and all these cool places, and I was like, and I got my top choice. I got Washington State. I was like really excited. And then I was like, but I don't really actually know anything about Pullman, Washington. Let me pull this up. And if you type Pullman,
It
Washington, at
rains.
least at the time, oh yeah, you pull it in and pull up the website, and it's like a picture of a round lentil with like arms coming off, and it's Taste E Lentil. That's the mascot of the town, and they have like a live. They were really excited back in 2006. They had like a live camera on the main street of their downtown area, and I think a tumbleweed blew by.
Stop it.
And I
Stop.
started like tearing up. I was like, I don't know what I'm doing.
You're like, no, no.
Yeah,
Well,
I
and
mean,
you're like super outdoorsy because you cycle and do a lot of stuff too. So then it's like, and it rains like 400 days a year, basically. So,
I will correct you on that because I was of the same misimpression. Pullman is on the east side of Washington. It's a high
oh, so
desert. It never rains. It's
okay,
just
okay,
it's like horrifically cold, where
okay.
it snows in July, but it's dry
But
as a
no
bone.
rain.
No rain, no rain.
Okay, good. Well, I lived in Washington State growing up for a couple years, for
Yeah,
4 years, and so
on the west side,
where
on the
I
west.
lived, it rained all the time when I was growing
Yes.
up. So that is my vision of it. So, okay,
Yeah.
but the residency for neurology, 3 years, 2 years, what does that look like exactly?
It, it's 3 years, and a lot of
Okay.
people will have to do specialty internships in between because it's become a very competitive field. Um,
Right.
and for my part, I'm a very big fan of specialty internships. I think that the residents that I have trained that have done specialty internships beforehand have been better prepared and take a lot more from the residency.
Mhm.
Um, but I didn't do that. I went straight into residency, and it was a 3 year program, and then you're out. You take in the middle of your second year, you take a certifying examination because we're under the umbrella of ACVIM. So we have to take a general exams to show we know general medicine, and then we
Yeah.
take the certifying examination. So
So did you, okay, a lot of neurologists I know, like I know some like at A&M that did like brain surgery and remove brain tumors, and then some that it seems like do more diagnosis and medical management, and then a lot that diagnose and also cut backs. But I also know some regular surgeons that cut backs. So tell me a little bit about the different, I guess, like categories of neurology and where you ended up, kind of where you are now.
sure. So I think that's what attracts people to neurology most. There's when I read through the residency applications and I see why people want to be neurologists, there's two reasons. One is because what I was alluding to before, the idea that the neurologic examination is one of the most romantic things left in veterinary medicine, where you get to like wave your hands and flip dogs' feet over, and then you say, aha, I know where their
Mhm.
problem is. Like that's the coolest part. But the second part is that I think a lot of us don't want to pigeonhole ourselves into being internists or medicine doctors versus surgeons. And we don't
Right.
want to give up radiology, but we don't want to give up pathology. And that's one of the values of neurology is that you have the opportunity to do all those things,
Do it
medicine,
all.
surgery, pathology, radiology. Now, some residencies will push you in one direction and some residencies will push you in another. And certainly there are external pressures to suggest, well, should all neurologists have to do surgery or not? But at the moment, you could do whatever you want. You could make your career whatever you want it to be. I have residents that have finished our program, which is pretty surgical based, and come out to decide they want to be essentially epileptologists. And then I've had others that have come out and said, I only want to do neurosurgery. I never want to look at an MRI. I want a radiologist to look at it for me, and then I'll do what
Yeah,
they tell me to do.
that would be me.
Um,
Yeah. I'm
the
like, let me cut. I want to
Yeah,
cut. I don't want to do
I
anything
get
else.
it.
Yeah.
I
Yeah.
get it. I get it. And then, but there's turf wars, just like in other things. So, who reads an MRI? Does a radiologist read it or does a neurologist read it? Who's better at reading it? That's a turf war. And another little turf war is who should be doing neurosurgery, surgeons or neurologists. And because of that, um, I think there are groups that fight with each other about it.
Hmm.
I'm proud to say I'm part of a group called the Veterinary Neurosurgical Society that said, hey, and it was started by a colleague of mine, Todd Axelin and Amy Faber, and it's basically said, hey, we're not on different teams here. Let's decide to get together, surgeons, neurologists, and whoever else, and figure out not who should be doing this, but what's the best way of doing it. So,
Right.
yeah.
Right. I like that. The ER I work at, the specialty one, we actually don't have a neurology department. And so if we have a down dog come in, we diagnose it, ER does, and then we call in just the surgery center to cut them. And it kind of depends, when we call them in or if they wait till the morning. But there is a neurologist on the road. And so for other neurological type issues, we basically have to send them to another specialty center to be worked up and get more information and analyzing. So, the I have a very small, I guess, experience with neurology and basically passing it off to one or the other type situation. But I don't have a neurosurgeon specifically that we work with or we refer to. And so I thought it was interesting, kind of the different dynamics. Now, do you do any sort of brain tumor type surgeries? Because I've had quite a few like cats with brain tumors and they've actually had surgery and done well. Like as a GP, I've referred them to A&M. Is that something you do, or is it mainly backs, spinal cords, that type of surgery?
Do both. Yeah. So, cat brain tumors are, I mean, they're like gold when they come in. You can't be
Yeah,
more excited about them
apparently.
because, yeah, because cat meningiomas specifically are benign tumors that are well shelled out, and just like any other integumental tumor, if you take it out, it's gone. And
Yeah.
so they're very rewarding cases because the cats come in extraordinarily debilitated. Um, and then you do surgery, which is usually pretty simple surgery relative to the other neurosurgeries we do. And not only do they go home back to their normal state, but owners will come back for their suture removal and say, I didn't realize that I didn't have my cat for a year, because these meningiomas have been there for a long time. And they say, thank you for giving me my cat, not my cat back from a week ago, but my cat back from a year ago. So those are very
Yeah.
rewarding. Lately, we've done a lot of ventricular perineal shunts, which are for hydrocephalus, so dogs that have too much fluid in their brain.
Mhm.
Um, yeah, so I'd say that brain surgery is the choice to do it is a little bit complicated. In cats, it's easy. Shunts, it's reasonable. But with the impressive improvements in radiosurgery and radiation therapy, you really have to be you have to be skeptic, like your own self skeptic of what the best thing is for that patient, you know, and the desire to cut and fix these things is sometimes superseded by the minimally invasive but superior prognosis associated with radiation. Um, but I do a lot of spines, probably more. I'd say I probably do 3 spine surgeries for every brain surgery. And those spine surgeries are usually decompressive surgeries, but sometimes they're stabilizations or other things like that.
I basically say, so I'm gonna send you to someone a lot smarter than me who's gonna like figure out what's best, because I never want to say to somebody like, you're gonna go to the specialist and this is for sure what's gonna happen, because I do agree that I always tell them, like, as a GP, there's a lot of stuff I know, but I cannot keep up to date with all the most recent recommendations for different types of tumors and different types of treatments. And so that's definitely one of those, like, you're going to this person who this is all they do and this is all they know about. And they will walk you through it. And I always kind of prep clients, like, pay for the consultation and talk to him, but that doesn't mean you're committing to surgery. It doesn't mean you're committing to anything, but it gets you that information, right? To kind of suss out what's going to be best for your pet and your finances and the long-term prognosis. So I like that you're saying, you know, all the recent advances, because I always kind of feel like I should know all these things, but I just feel like as a GP vet, there's no way for me to keep up with all the information that's out there.
For sure. I think so. In the New England Journal of Medicine back in like the early 2000s, they came up with this term neurophobia. And when they studied a bunch of medical students, what they found, they studied their cortisol levels and their blood pressure relative to different topics. And when it came to neurology, it was through the roof. It was definitely the thing that made them the most frightened. And I think that, you know, neurology is in a lot of ways made inapproachable in the veterinary school curriculum, because you have to study all these nuclei and you have to understand all these different pathways. And ultimately, that's not really what we do clinically. You know, what we do is much more straightforward than that. And so the coronavirus has really given me, and I think you too, like social media platform to share things to make them more approachable to the
Mm-hmm.
standard veterinarian. And the truth is that we are the Batman of the neurology world. It's not that hard. It's just you need to remember a small few things, and then it's going to be very approachable. So the reason I mention that is when you say something to me like, I'm going to send you someone smarter than me, I'm like, nope, that's not what this is. I watch your videos all the time and I'm in awe. You know, it's really, it's not, it's just more of a narrow skill set. It's just,
Mm-hmm.
it's just a narrow skill set. It's by no means smarter. And my job is to make my referring veterinarians look better, not make them look subservient or, or even referring. They're my colleagues. They're sending something to me because I can do a lot with a little, as opposed to a little with a lot, you know? And so, or
Yeah.
actually I said that backwards, but my point is that you got, the generalist is not sending something to me because I'm smarter. They're just sending something to me because I know how to do a little piece of something, but ultimately we're colleagues. It's not a hierarchy, you know? So.
Well, I appreciate that, because I have had some experiences with maybe different specialists, and especially with interns and residents training. And I'm pretty like straightforward, you know. And I had one. resident who, I mean, this guy was just really full of himself and really everything that a GP sent him. I mean, it was just tearing apart what was done and what was said. And, and I finally turned to him and I said, let me tell you something. I would never refer to you. I do not care if you are the best specialist in the whole entire world. I would send 0 clients to you, because if you are going to say these things about me as a general practicing vet and you aren't going to be a part of my team, we need to be a team, then I'm not sending
100%.
them to you. Like, you have to be kind and you have to work together. And I love that you have that perspective, and that's hopefully, I'm sure that's what you're training like your students and your residents in also, that as a group we are a community and we're here to encourage each other and teach each other. And I always learn stuff from your videos. I love the videos where you're like showing how painful pets are and what you did, and then showing like the after effect. And I've actually had some clients like watch some of what you've done, because it's hard for clients to understand, like, my dog's going to go through this big surgery and spend a fair amount of money, like what can they expect? But I think it's great to show the visual of the outcome, and these pets are so painful and it's so hard for them. And I just keep trying to explain to clients, like, we can help them, really, really can. Like, we need to do this. We need to take this jump. So I really do appreciate what you're putting out there. I don't understand half of it, I'll be honest, but no, but I really think it's great information. I had a lot of people, you were talking about skill set. I had a lot of people asking, like, what makes a good neurosurgeon, or what type of skills or personality do you need if you want to like pursue that track? So can you speak to that a little bit? Like, what types of students you feel like do really well, and what type of students might struggle a little bit more, I guess?
Yeah, that's great. So one of the best parts of my career is I still train residents. When I was at University of Missouri, we had such a great relationship that I decided I wanted to go into private practice, but we decided to continue this hybrid residency program, which has been really great, because now instead of having to choose academia versus private practice, you get the best of both worlds.
Right.
And part of choosing those residents is, of course, they say in the interview process, well, what are you looking for? And each of us said something different. What one of my closest mentors, Denny O'Brien, would say is slave labor. He was looking for slave labor. And he's the nicest guy if you know him. So he was saying it tongue in cheek, but basically that is part of what makes an excellent resident, is tremendous perseverance, resilience, and recognizing that you're dedicating 3 years of your life to
Mm-hmm.
becoming the best that you can be at something you're going to do for the rest of your life. So
Right.
I think that if you're really in it, you're going to be successful. The thing that I would always say is passion. I can do anything with passion or enthusiasm. So I don't need a resident that's the smartest in the room, nor do I need one that knows how to handle a drill. I just need someone that really cares about it. And if they love it, it's going to come through. Our pets are both jumping into our
I know.
Instagram
I'm
feed.
sorry.
I love it. No, I love it. And then I think that some people might say anatomy would be the third thing. Like, you have to love anatomy to do neurology, more than understanding pathways and processes and physiology. Neurology is about space. It's about location. It's about placement. And so you have to love anatomy too. So.
I do love anatomy, but there's a lot of anatomy in a brain and the spinal cord. I mean, there's a lot of very small things in a very small space. So I appreciate that those of you that do it are very interested in it. So you talked about passion. You have other things that you do outside of work. Can you talk a little bit about like your schedule and how you kind of balance it all? And do you feel like as a specialist, you maybe have a good balance with where you've chosen to work and what you're doing, or do you feel like it could be better? What do you think?
I'm a veterinarian, so I have a horrible work-life balance. But I think it's because a lot of us, and I know myself certainly, my identity is my job, right? And so I take so much joy from my job that sometimes it can supplant and push aside things that I really care about otherwise,
Mhm.
relationships and other things. Um, where was I going with that? So I really, so from a work-life balance, I think that neurology can be, it can be challenging because you have so much call, and it can also be challenging because we're an emergency service. We are different
Right.
than every other service because You can have as many appointments as you want. So you can schedule the day the way you want. But ultimately, if that back dog comes in at 7 p.m. and it's not moving its legs, that's the end for you. You have to do it. And you have
Right.
to have a team and you have to have a perspective where you say, I don't have to stay and do this back dog. I get to stay and do this back dog because otherwise you'll just burn yourself into the ground.
Yeah.
So so yeah, I think it is a tough uh, job with regard to work-life balance. It, I if I wanted a better work-life balance, there were other specialties I could have chosen. Ophthalmology and radiology came to mind as disciplines that I really enjoyed, but also had a little bit more freedom with regard to non-emergent obligations.
Hmm.
Um, but I loved it too much to not do it. So.
Yeah. Do you think financially it has paid off? Because obviously doing an internship, doing a residency, I mean, you give up a lot financially in the first, 4 years. So do you feel like the opportunity for what you get paid afterwards is worth, I guess, that initial sacrifice?
Yeah, it's changing, you know. I think so you have to consider the fact that the average veterinarian, if we're speaking strictly about numbers, would come out of school making $75,000 a year out of like Penn, you know, in Northeast.
Hmm.
So, and then consider that in your internship and residency, cumulatively, you'll make about $100,000 over the next 4 years. So that means that you're $300,000 behind the eight ball essentially by the time you come out of residency. That's a lot of money.
Hmm.
Now, granted, you've pushed off those debts. Um, and then moving on to what type of money do you make as a specialist, it can vary anywhere between $150,000 a year to I know neurologists that make well over $500,000 a year. So I think it I think it can be lucrative and it can be worth it in the end. But if the reason that you're doing it is because you think it's going to be a lucrative veterinary choice, I think you're doing it for the wrong reasons, if that
Yeah.
makes sense.
I would say just in general, this profession, I there's nothing wrong with making money in this profession. I make good money. I'm proud of that. I don't feel like I need to tell people that, I barely make money and that's why they should respect me as a vet. I think that argument sucks, honestly. But I do think that if you really want to get in it and stay in it, just because emotionally it can be a really tough job, that you just have to love it. And it can't be about anything more than that. You have to have that passion, like you said. So
Yeah.
that's why I still love it after all these years, it's not because of the financial, compensation. So we had a question on here about what neurology resources do you think are the best for like vet students, for people who are interested in neurology? Are there books and things that you really like or online things that you really like?
Well, of course, my Instagram page is a
Yeah.
fantastic resource.
Yes.
And I do think that the Instagram, Zoom kind of opportunities have really opened up new avenues to real-time experience. But from a book perspective, I'm a big textbook fan. I care about them like I care about my pets.
Yeah.
I love my textbooks. Um, for the average veterinary student, I really like the BSAVA neurology manual. That's Simon Platt and Natasha Olby's book, and I really like Curtis Dewey and Ronaldo DaCosta's book. I think they're both like super approachable, and yet you won't grow out of them because I think there's just so much room in them. And then another really good book is my colleague's book, Joan Coates's book, The Handbook of Veterinary Neurology, which has been around since forever. It just keeps getting evolved. I find that to be another way of looking at things that everyone looks at neurology differently. For some people, it's where the problem is. For some people, it's this clinical signs they see. So if the clinical signs you see is what really triggers you, then that will be a better book for you. And then lastly, Delahunta's book, Delahunta Glass Kent, which is kind of like the Bible of veterinary neurology. I think it's in its fifth iteration right now. Like that is the book, but I wouldn't recommend it to the average veterinary student unless they had a passion for neurology because it's a little bit of a bigger undertaking. So that's kind of my like thoughts on books. I have to give a nod to my mentor's book, Rod Bagley. I think it needs like an update because it's been a little while, but it is another really it's another really great book. So.
And I attended your fetch talk that you gave, the live one, and that one was really good. And you had a lot of great videos. And I feel like for me, I'm a very like visual hands-on learner. So the videos you post where you just show like the gait abnormalities or the different neurologic exams and kind of what you're seeing and how that helped you identify the lesion, those things help me a lot because I can read about things, but really seeing what you were seeing, you know, when they were moving or when they were doing those very small specific things that made you kind of say, okay, I think it's more this than this, has been helpful to me. So I do think, are you going to be speaking at Fetch again coming up? Are you in May
Yeah,
or no?
as much as Adam will let me, I'll keep speaking
Yeah.
at Fetch. Um, and I'd also like I'm doing a Vet Girl talk as well, and I really want to continue doing kind of these online, maybe not as formal ones as well, because I some of the best experiences I've had with veterinary students since COVID has been like, hey, it's Saturday morning and I have 8 inpatients. Do you guys want to look at them with me? And then that was like a very fun experience. So
Yes. Yeah.
it's the gait stuff and just looking at animals is such a fun part of neurology. I remember trying to decide if I wanted to be an ophthalmologist or a neurologist, and I looked at slides of the back of the eye over and over. I'm like, this is beautiful and fascinating, and
Yeah.
it's not life or death. It's not life or death, and it's not real enough for me. And then I watched Dr. De La Junta again at Cornell, the godfather of veterinary neurology, just basically put video after video after video of dog and be able to figure out where their problem is just by looking at them and help them. It was just so exciting. And so if I had one goal in my entire veterinary career, it would be to be able to teach veterinarians of all levels how to look at a dog walk and say, I know exactly where your problem is. Because there's so much confidence that comes with that. And there's
Mhm.
so much self-fulfillment and joy from being able to do that. So
Well, I think you and I might need to have some sort of Zoom session where we kind of go through some like GP cases and, just like I could come up with this is what I saw and this is what I was thinking, and then have you kind of talk to me because I have a lot of great questions. Like I have a lot of neurologists that say like, steroids versus NSAIDs for backs. And I think there's a lot of really interesting things that just as GP, which a majority of students are going to be, I think there's some just really like quick and dirty things that we can maybe do and go over together, or even come up with a joint fetch talk for Adam, with like
but
the top 10 things you need to know as a GP and a, neurologist kind of thing. So that would be good. I did have quite a few students who said they actually don't have a neurologist at their vet school. So do you have recommendations like what they should do to establish those relationships or visit places? What can they do with everything going on right now?
yeah, I definitely want to do those talks with you. I think that would be great.
Yeah.
Um, if you don't have a neurologist at your veterinary school, I think it is and you're interested in neurology, I think it's very important that you get a preceptorship and spend 2 weeks at a clinic where you get to work with a neurologist. And I would highly recommend that you do that at an academic institution and not a private practice. I know that often there is a desire to do preceptorships in the private sector because you're in a clinical hospital, but in an academic setting, you're going to get exposure to lot more neurologists in general. But you're going to get exposure to a lot of other veterinary students, and you're going to get a lot of exposure to other services and a feel for what other veterinary hospitals can be like. Um, the pace of private practice can be a little fast, and if you haven't had a preceptorship or a core rotation in an academic institution, I think it's a mistake to go into the private sector. In fact, I have students come through our service all the time, and it is a prerequisite that they've done an academic core rotation beforehand because otherwise they get lost. It's too fast.
Yeah. Yeah.
Yeah.
I like that. I think that's good because you need something to build upon, and I even have our general practice is really, really busy and fast paced. And I have students that visit me. And I've had some that it's like the beginning of their fourth year and it's their first, couple of rotations. And they are just like, holy cow, this is a lot. And if they're later along in their fourth year, they've already been to other practices. They've done, like you said, more of those different rotations. And so they're a little more comfortable when I'm like throwing things at them and I'm really wanting to give them a lot of hands-on experience. So I think that is good. I think it's really important to schedule your preceptorships or externships really smartly, to get as much experience as you can, or even your holidays and breaks. If you're really interested in something, I tell students, like, even if you can only go spend like a couple days somewhere, like, do it and start establishing those, relationships early on in your career. Because by the time you're a fourth year, if you really want to go, like, if someone wants to hang out with you, if they've already talked to you several times and they've interacted with you, I know I'm much more likely to be like, yes, let me find a time for you to come visit me if we have some sort of relationship already. Do you feel like
Yeah,
that networking is important?
yeah, you actually segued into exactly what I was going to say, which is my first preceptorship was a neurology rotation at the University of Missouri. And had it
Yeah.
not been for that experience, not only would I probably have not gotten to the letters, I got a letter of reference from that preceptorship that I'm pretty sure secured me an internship, but it was also what made me go want to go back there for a career. So I think that those experiences are invaluable. And I think it goes well beyond just learning the topic that you're most interested in. I think, like you're alluding to, the networking is huge. And seeing how things work at another veterinary teaching hospital is a really cool thing to do.
Yeah,
And
because it's
another side, I was going to say, side note, I made friends with veterinary students there that I still keep in touch with now. Like, it's really cool to see people that are outside your class, but still pursuing things at the level that you are and
Mhm.
connect with them. That's really fun.
Yeah, I agree. And I think this community is pretty small. And I feel like Instagram has kind of shown me that. Like, there's a lot of us that are, even if we're dealing with different things, general practice, specialty, like, it's still, we feel very connected, right? Because at our cores, we all still really just love this and love helping animals and helping people by helping animals. And so I think it's important to kind of feel that and feel supported and feel connected with other members of our community, because I think that's where people kind of get lost, in the veterinary world, if they don't have those connections and have that networking ability. So I'm huge on that. I'm like, reach out, just reach out, put yourself out there. Some people are going to love you, some people aren't, but it's okay. You'll find your people, and your people will help you kind of get, through this career in general. So I'm definitely going to be hitting Adam up tomorrow. I'm going to be texting him and be like, okay, I talked to Animal Neurodoc and we're going to do a talk. And he'll be like,
Let's do
great,
it.
we'll do it. Yeah.
Yeah, I would
He'll be
love
all
that.
about it.
That'd be awesome.
Yeah.
Good.
That's great. And then hopefully eventually we'll be in person, because I feel like I know certain people so well already. And I'm like, when are we going to just go out and all hang out together? Because I love doing this stuff. I love talking to people, but I just really want to meet people in real life too. So,
Absolutely. I feel the same way. 100%.
do you have the best place for people to reach out to you? Kind of tell us the best ways to connect with you if students have more questions, or people just want to follow up in general.
Yeah, so I'm always available at my handle, Animal Neurodoc. I try to answer as quickly as I can. If you're interested in some of my other side stuff, I have a company called 3D Veterinary Printing where we do some really neat customized instruments for individual patients. But really, the best way to do it is just follow the site, and I really want to start incorporating with you and just in general more kind of like impromptu sessions. Hey, let's just talk about this topic. Um, Recently, I put this post up about seizures, and I was really hesitant. I've been sitting on this video for a year, and
All
it's an
that.
emotion. I don't know if you saw it, but
Yeah, I did.
it's a very emotional video. And I think, the reason I was so hesitant to post it was because I didn't want to sensationalize something that was so hard for somebody. And I think that media in general, like that's easy to do, right? You show something that's hard for one person, but because it's so shocking, it garners attention, and that's great.
Mhm.
Um, but I really wanted to share with veterinarians and veterinary students how difficult it is for our clients, and we don't know what it's like to be in their homes. And so that particular post, despite the fact that I was so hesitant to post it, really got me feedback to make me remember that our community is very special, and it's not about look what I can do. It's about how do I help these people. It's a very empathetic group of people, and I feel really fortunate to be a part of it. So
Yeah, I think that post is really important. Like, I, it's hard to watch, but like you said, peeling back the curtain and just being like, this is the reality, right, of certain things, I think is really good. And I think the way you did it, you presented it very professionally, but like you said, with empathy. So that's all we can do, because sometimes things are really hard in our profession in general. So
Yeah.
I think that's a good note to end on. I could really ask you 50 million more questions, but we're going to have to just do something else together to share a little bit more with each other. So I appreciate you being on here very, very much. And I definitely tell people reach out, because I do feel like you've been really responsive. I've asked you questions too about things you've posted or videos, and you've helped me with cases and with things. So I really do appreciate that. And I feel like both of us are muddling through this social media thing, but we seem to have found our niches a little bit. So it's fun to talk to other vets who've been practice a while, who are figuring out like I am. So I just appreciate you coming on here, and thank you very much for being here.
Well, I learned from watching you do it. I steal some of your techniques, so I hope that's okay. And
Well, good,
I
good.
I look forward to meeting you in person because it's time for
Yeah.
that. I'm ready. So
Yes, I agree. I agree. All right. You guys have a great night. Thank you for watching so much. Reach out to either of us if you have more questions, and I'll be back next Sunday. I have a therogenologist that'll be on with me, so it'll be exciting. Thanks, guys. Bye.
thank you. Bye.